Welcome to a special edition of Hometown Happenings. I'm Supervisor George Hoehm, and thank you for joining us. Recently, I had the opportunity to sit down and speak with a very dear friend, the CEO of NIACC Montefiore Hospital, Dr. Mark Geller. And he provided a COVID update, and we shared some experiences that we had gone through jointly here in the town of Clarkstown and Rockland County regarding COVID. On this edition, you'll get a bit of an update and some reminders about what we need to do. We need to continue to socially distance. We need to be safe. We need to have proper hand hygiene and wear our face masks. And we need to make sure that we're looking out for one another. But most importantly, what you'll hear on this show is a bit of a retrospective about what we were kind of facing through some of the darkest days of COVID. I personally can tell you, as your town supervisor, I worked with the other four town supervisors very closely, along with Dr. Geller and Dr. Leahy and other partners in government. And we dealt with the types of things that I never would have thought I would be dealing with as your supervisor, namely how to find PPE and ventilators, how to make sure that we're addressing public policy questions that we sometimes perhaps took for granted, both as a nation and as a community. We also had to really grapple with some very, very challenging and difficult times. I can recall late in April and early May where I and the other town supervisors were very concerned if we were going to be able to continue to provide the level of services based upon the number of infections that were plaguing our ambulance corps and our police departments. And it was really through the efforts of all of us banding together, the supervisors with our staffs, with the hospitals, and with our emergency care workers. And I'm so grateful that Dr. Geller has taken the time to really provide some reflection and an update as we face that situation and that crisis. And we're not through it yet, but we're not in those horrible days of April and May and June where businesses were completely shuttered and where hundreds and hundreds of Rockland County residents and Clarkstown residents were sick from this dreaded illness. So we're moving forward, it's positive, and we still have a ways to go. But it's really a great opportunity to listen to Dr. Geller and get some reminders and really reflect on what we've been through these past 7 months. So stay tuned, enjoy this show, and we'll be back at the end. Thank you. So welcome back. My next guest is Dr. Mark Geller, the CEO of Montefiore NIACC Hospital. Welcome, Dr. Geller.
Thank you.
So, Doctor, aside from being a good friend, you are really one of the unsung heroes of Rockland County in so many ways through the COVID crisis. And we'll speak a little bit about that, but because that's really the focus. We'll give a little bit of an update on some of the things that took place here in Rockland County as a result of COVID and maybe some of the things we might anticipate going forward. But your efforts at Montefiore NIACC were just so incredible. Your staff, you personally, and we really were at a point where it was a very critical situation early on in COVID, and I know your communication with both me and the other four town supervisors was invaluable to me and the town supervisors in making public planning and policy decisions for our residents, and I want to thank you for that. So you have a very busy schedule, and I'm delighted that you took time to be able to come in and appear and sit for this interview so we could give some information to our residents. Before we get to all of that, though, maybe just talk a little bit about your background, your education, Sure. How long you've been at Montefiore.
Sure. First, I'd just like to thank you for the very kind words. They really should be focused more on our team at Montefiore NIACC Hospital. They did amazing things to get us through the crisis. They were stretched to just about their limit, but they bent, but they never broke. And I think it was in large measure just because they're wonderful people and great providers and staff members, but also the community support was amazing. I think one of the things that helped us get across the finish line was just the amazing outpouring of support from the community. I think that invigorated the team. It helped them feel connected and when things were dark, and they really, that lifted them, their spirit. And I also want to thank you for your support, specifically, and the other supervisors' support as well. We could not have gotten across the finish line without support from local government, from local leadership, doing the correct messaging, staying on point, and helping us get some of the supplies that we needed, which was really very important in those early days. And then also from the health system. I think that was critical. The Montefiore health system was very supportive. I can't imagine a community hospital going through this alone. Great to have the community support, great to have the support of leadership, but it was also wonderful to have the support of the health system behind us to help us get through the significant portion of the crisis. Now we're focused on returning to the new normal. So COVID is still out there, but the acute crisis, at least for now, is over. So we are trying to message to the community that it's safe to come to the hospital. Don't put off health care for fear of being in a hospital. It's actually probably safer to be in the hospital than the community. As we tested folks, we tested the community, we tested healthcare workers. Healthcare workers actually tested at about half the rate of the community. So the precautions we put in place in the hospital really do protect against the COVID virus. The other thing we're noticing is that because folks are concerned about going back to a hospital or going to an emergency room, they're deferring care. So we're seeing late presentations of things had folks presented earlier, could have been dealt with earlier, and the outcomes could have been quicker and better. So again, don't put off health care concerns or needs for fear of coming to the hospital or the emergency room for COVID. Some things we're doing now, we're finishing the second portion of the emergency room renovation. Thankfully, we had the first phase open, which we converted into 3 ICUs. We had 30 ICU beds in the emergency room during the COVID crisis. Now it's resumed its normal activities, and we're renovating the old space, and we'll bring that online in the next 6 months or so. But it's been a magical transformation. It is so much better than the prior state, and I, to the extent anybody would like to see it, I'd love to show it to them. And we're also working this year to finish our cardiac catheterization lab. So one of the things that has been sorely needed in the county is greater access to that service. Rockland County has twice the mortality rate from cardiac events than surrounding counties, and we think it's largely related to access. So our opening up this cardiac catheterization lab will give greater access to the community, and we're doing it in conjunction with the Montefiore Health System. So we're going to have folks from the Montefiore Health System support us as well. And with that, we've opened up cardiac rehabilitation. We're opening up a congestive heart failure unit and advanced cardiac imaging. So we're going to have the full support of cardiology services by the end of this year at Montefiore NIACC Hospital.
And what's beautiful about that, and really, there's so many folks that, and you'll often hear, and I hear sometimes I go to senior clubs and somebody's having a procedure and they're going to the city. And really Montefiore is a city hospital system that's up here in the counties, not just here in NIACC, but other parts of the Hudson Valley as well. And so there's an enormous amount of resources from that system where you're getting some of the best care in the world, as a system. And so now you're bringing that to Rockland County, to NIACC, which is really, it's something where you don't have to go into the city necessarily. And a lot of people, they think, I have to go down to, a city hospital, but you're really going to have it here. The quality is here. Yeah,
so they'll be cooperating that site with us. So we will have actually Montefiore faculty with us providing services. And one of the best kept secrets, and it was actually new to me as well, is that the Montefiore Health System has the best survival rates and outcomes data for cardiac surgery in New York State. So they are doing a wonderful job, and now we are linked in a way that makes care continuous. So an event that happens at NIACC can be seamlessly transferred to the Montefiore Health System quickly, easily, and with the comfort of knowing that you're going to a place that provides some of the best services in New York State. So. Absolutely.
And really, Dr. Geller, you've had an outsized impact on Rockland County through your leadership as CEO at Montefiore NIACC. How long are you the CEO there now?
So I've been CEO now for 5 years.
Mm-hmm.
I was a clinician, so I worked as a physician at NIACC Hospital, Montefiore NIACC Hospital, until late 2014. I took the role of CEO late 2014 until now.
Mm-hmm.
And it's been a wonderful journey for me, because as a clinician, you can see what needs to be fixed, what needs to be done, what might be done better, but don't have the ability to really impact that.
Mm-hmm.
Having taken the position, I've had the unique opportunity to sort of execute against the things that I thought might better help the hospital, and in turn help the community. So it's been wonderful for me to start seeing the fruits of those labors actually come into existence.
Right, and there's been a repositioning and a transforming of the hospital with obviously the new emergency room, the cardiac cath lab, and some of the other capital projects that you've done. So it's you haven't taken it easy for 5 years. Before COVID, you really, and the whole renaming and repositioning and the relationship aspect with NIACC and Montefiore, that's really all been through your, during your tenure as CEO. So it's quite impressive, what you've been able to accomplish down there. Maybe we could pivot to COVID. And maybe I want to talk a little bit about what we think, down the road, and maybe just some of the general precautions and things we can tell residents. But maybe we can go back a little bit. Let's turn the page back a couple of months. The shutdown happens in March, and the numbers start to dramatically increase. And we're all kind of starting to talk to each other, the supervisors. I've known you personally for a number of years, and good friend, and picked up the phone, and we started talking, and and finding out you're having issues getting supplies, we're having issues getting supplies, and we're trying to figure it out. We had situations in the town where at one point, in April, we weren't certain that we were going to have, if somebody called 911, if we were going to have an ambulance, people on an ambulance to be able to go make the call to the house. We had to change policies, we had to change procedures. It was a whole new way of doing things, and a lot of it was on the fly. What was that like for you, those first couple of weeks of COVID, and trying to provide the critical care for Rockland's residents at the hospital?
Yeah, so it takes me back a little bit. But so what we first became aware of, and I think it was when we started seeing images coming from Italy, that we were getting a sense of what might happen here. And we started preparing for that, as did the country to a greater or larger degree. In the middle of March, the governor asked that we stop doing elective procedures and ambulatory procedures, and we stopped doing those things, and we were tasked with building capacity for about 150% of what we usually, or what we have at our most. And so we tried to discharge everybody that we could. And then there was this 2-week period where there was this eerie silence when you walked the halls, and it was kind of the calm before the storm, and we weren't quite sure what the storm was going to look like, but it was that just very eerie period where the hospital was really quiet. And then first weekend in April, last weekend in March, the floodgates opened, and we were getting a tremendous number of positive patients, some not sick, but some very, very sick. And it's a novel virus. We really didn't know how to treat it. There was no guidance on how to treat it, so it was kind of figure it out. And I just remember the number of patients presenting to the ER that were crashing and needed intubation. And so from my perspective, my goal was, first, how do we protect our providers so that they can safely go and take care of patients? Because if we don't protect our providers, we're not going to have providers to care for patients. So the first task was finding personal protective equipment. But the reality was we thought of it as needing more, but we didn't think of it as we were going to need a lot more. So on a typical day, we have maybe 15 patients in isolation. That's when you need personal protective gear. At the peak, we had 280 patients. So the burn of personal protective gear was enormous. So sourcing personal protective gear, making sure that we had the right number of ventilators, making it safe for the staff, and providing for the needs of the community. That was my almost sole focus the first several weeks, and there was no one place to do this. So we relied on local leadership in the county, but we sourced from everywhere, and we were able to put it together. But there were times when we were down to one ventilator, and you didn't know what the night was going to bring, and you didn't know what the next day was going to deliver as it relates to ventilators. So it was tense and anxiety provoking, but the team was focused on this mission. They got extraordinarily focused. Everybody wanted to succeed, and so for me, making sure that we kept staff safe and making sure that we had the necessary supplies to care for our patients was paramount. And then after that, we had to start figuring out how to treat the disease, and we have extraordinary medical leadership at the hospital, and there was really no guidance on how do you treat these patients, and our team figured it out. And I would say between the time we saw our first patient and the time when we were sort of discharging our last patients from the intensive care unit, our team knocked the mortality rate in half, if not greater. So they figured out that with convalescent plasma, remdesivir, dexamethasone, which is a steroid, anticoagulation, proning, all things people are doing now, but nobody knew that those were the things to do then. So they kind of figured it out on their own, as everybody else was in the community. They did an amazing job.
It's absolutely a remarkable story. Just jumping back to the PPE, I'll never forget. It's like I never would have thought as town supervisor that I'd be trying to source ventilators, for the local hospitals. And I remember, talking with you on the phone, and you're like, do you know anybody? And luckily, we were able to reach out initially through the town of Ramapo to one of their key staff, Mona Montel, and she connected us with not just you, but the towns. And frankly, the county health department wasn't getting the supplies, so ultimately it really came down to some local suppliers that had some hooks into international supply chains and were able to get some of the earlier PPE coming in. But at one point, what your typical ICU, you went to like 5 ICUs, right? I mean,
we actually went to 6. So we had 60 patients in the ICU. Today we have maybe 12.
Right.
So it was about 5 times the number.
And you had to get ventilators. I know I heard you speak once before about, I think you even reached out to Elon Musk for ventilators?
We did, yeah, we did. I did. I'm a naive Twitter user, and there was a tweet from Elon Musk, if you need ventilators, tweet me. And I tweeted, this Dr. Mark Geller, CEO of Montefiore Hospital. Our hospital is in Rockland County, which is the hottest county in the hottest state. We're down to 1 ventilator. Can you help us out? And then 5 minutes later, CNN called. And then 10 minutes later, WCBS called. I said, wow, I didn't mean to broadcast this to the world. I just wanted Elon Musk to know that we could use some ventilators. But ultimately they did. They actually did provide us with 28 ventilators light, so that we could use them sort of as a bridge to a real ventilator. But they really were supportive, and it was really doing things like that. We reached out to relief organizations that usually send their relief to Africa. But there was, and they had stores of these kinds of things in the United States, and we asked, and they sent. But I'll tell you, the town of Ramapo was extraordinarily helpful. The first time we were really short on PPE, I connected with Mona, and she said, meet me in a place, and I met her in a place, and I saw Dr. Leahy there, so I knew I was in the right place. And they had a lot of PPE, and I said, we'll take it all. And that tided us over for quite a bit.
Right, and it was really through those connections, early on with the towns and the 5 town supervisors, because really and it's not a knock, it's just I think the county was really kind of caught by surprise, county health department, and we just didn't have, and they weren't getting the supplies either. Nobody was really prepared. And so for our police departments and for our ambulance corps, and it was a significant amount of equipment. And then early on in the crisis, we were, never forget, in April, just around Easter time, we were kind of getting to the point where it was like bending, and are we going to make it? And we had a number of officers out. Maybe speak about that time frame. It got really close at one point,
Yeah.
the whole system.
Yeah, so for me, it's probably about also that April timeframe. You know, short on PPE, short on vents, short on a lot of the things that we needed. And then we had 60 patients in intensive care, and we have staff usually for 2, maybe 3 units. So we had, you know, half the staff, and we were still waiting for staff to come in from outside the community. So it was really just with our current staff. And I would go to bed every night wondering, you know, if the next day people are just going to say, I'm out, too much, I can't take care of it, I'm bringing it home, I have family I have to worry about, the things I'm seeing here are just, you know, are causing a lot of stress. It was a very stressful work environment, and I probably wouldn't have blamed anybody for saying, you know, I have family, and I have myself to think about, and on top of that I have a lot of sick patients. I can't do it, but in an amazing fashion, they bent, but they never broke. Nobody ever said, I'm out. They all stuck with us. And then in the beginning of April, we started getting staff from outside the community to come and support us. And they were amazing. They were coming in from North Dakota and Kansas and Texas and Florida, great attitudes, ready to roll up sleeves. And they relieved our staff and also brought with them just great energy and desire to help. And it, you know, along with the community support, really buoyed our team. But yeah, I can perfectly understand. It had to be the same thing for you as well, whether or not you're going to have the number of officers to put on the street, the number of EMS to put on the street that really needed to care for the overwhelming needs of the community.
And of course, I think we all dealt with it. I know NIACC did as well. I mean, there were some real tragic deaths, you know, through this. There were providers that passed away.
Yeah.
There were some very, very difficult, and some folks from your own ER that had passed away as well. So it was a very difficult time. Thankfully, we survived that. We moved through, and now where we are at, the numbers have been pretty static through the summer. We're seeing an increase now as the taping of this. You know, at the very end of September. The numbers are going up in Rockland, but they're not really translating yet to care in the hospital.
No. I just want to remind everybody that you know, as we go into the fall and we make recommendations on what we think would help protect us best against you know, resurgence of virus, understand that we lost 4 providers to COVID because they were caring for sick people. We had at any one time 100 staff members out sick because they were caring for people in the community. We don't want to get back to that place again. We hope never to lose another staff member to that. So if we can do the things that you message and that others are messaging, you know, I think we can mitigate what happens in the fall. But specifically as it relates to what's going on in the county today, yes, we're seeing an increase, very gradual, in the positivity rate. It's anywhere from 3 to 4%. 5% is kind of the lower end of where we start getting very concerned. Hospitalizations are a lagging indicator, so the numbers have only been going up for the last 2 or 3 weeks. You know, for us to see it, if it's going to be material, it takes 2, 3, 4 weeks. So we're not there yet. The number of patients we see on any given day within the hospital are in the low single digits. You know, we admit 0 to 1 patient a day. Most of the patients who are positive in the hospital today are incidentally positive because we're now testing everybody who comes in. So if you come in for a delivery because you're pregnant, we're going to test you. Folks may be positive, but they're asymptomatic. So we're not seeing any significant increase in the number of symptomatic patients or dramatic increase in the number of COVID positive patients. But again, it's something we're keeping our eye on because it is gradually increasing.
So let's talk a little bit about going forward. What are like the things that you really can message and recommend for our residents to protect themselves and other just general, you know, we're going into flu season as well, correct? So
Yes.
I mean, what would be some of your recommendations and reminders for the public?
So, you know, I think the state and the county have been the communities have been really good to this point. The infection rate, we knocked the infection rate down. We got it very low, and now the goal is to keep it there. And it's the same things we've been doing all along, is wearing a mask, hand hygiene, social distancing where possible, and staying at home if you're sick or getting tested. Where I get concerned is, we just had Labor Day. I don't know if that contributed to the rising infection rate. There's the natural tendency to become COVID fatigued or COVID complacent and to stop doing the things in a religious or rigorous way, just because the infection rate's low, and we've been at this for months. It could be easy to slip back into that. We're moving inside as it gets colder, so that's another risk factor. So all those things, and people are going back to work and back to school. So all those things can contribute to an increased infection rate. So again, masks, social distancing, meticulous hand hygiene, isolate yourself if you're sick and get tested. If we can continue to do those things as we wait for treatments or better testing or a vaccine that's effective, it'll help us get there and not have a significant resurgence. And the second benefit to all that is, if we do that for COVID, it's going to help us with flu, because flu is a respiratory virus also. And the same things that are protective for COVID are protective for flu. Get your flu shot, do the same things, and we won't have a bad flu season. So it's conceivable it could be not so bad, but it's really up to us as a community to determine that.
Right. And the flu, typically, we can lose a couple 100,000 people from the flu every year in our country, right?
Yeah, it's tens of thousands, so 20 to 40,000 thereabouts, either directly related to flu or flu-related illnesses. So I mean, we don't want that to add to what we're already experiencing on the COVID side.
Right. One other thing I wanted to touch base on just quickly. You had a beautiful expression of support from the community. At some point, I want you to maybe just talk a little bit about some of the one aspect of it. You would, as people were isolated in the hospital, you wanted to be able to communicate through iPads, and you would an outreach on that. Maybe you could speak about that, and then I also want you to talk a little bit about the great Beatles song, "Here Comes the Sun," and really something unique that the hospital did as people were coming off of ventilators. Maybe speak about both of those.
So one of the things that was most tragic about this experience we had was that no visitors were allowed at the hospital. The Department of Health restricted all visitation. So family members, friends would get sick, and they'd be by themselves in the hospital. And there was really no great way for communication other than by phone. So what we decided to do was go to the community and ask for support. We thought maybe if we could FaceTime patients and families, that would make it easier for providers who were really upset because they were there trying to support patients because they couldn't see their family members, and that wore on the staff members just because they bore that emotion. It was a very powerful thing, seeing patients really sick and not and isolated. That was a heavy burden to bear for the staff, but also for the patients and family members. How could we unburden them somewhat? So we asked for donations. We went on social media and asked for donations. We were trying to get 30 iPads. We thought, well, if we could get 30 iPads, we can move them around the hospital, and we can, get at least one session a day per patient, maybe. And we ended up getting 592.
Wow.
Which was overwhelming and crazy, and such a tremendous expression of support for the hospital. But we actually got volunteers and people who weren't directly related in caring for COVID patients or doing other things in the hospital. They formed a team, and we made sure that everybody had FaceTime with their families whenever they would like. And it was, I think it helped for family members who were at home and couldn't be at the side of the bed with a loved one. And it gave the staff an opportunity to help see the relief of burden of that social isolation. So it was a win for everybody, patients, family members, and staff. The other thing we decided to do, because the first month or so was oppressive, and it was, we decided we needed to stop thinking about what was bad and what we could do to celebrate. So one of the things we made a conscious decision to do was every time we took a patient off a ventilator, and every time we discharged a patient from the intensive care unit to a regular floor, we would play Here Comes the Sun overhead. And I remember the first time I heard it playing, and people were crying and people were dancing in the hallways. It was really, I still get emotional about it. It was very uplifting. And we did a lot of other things to celebrate as well. We did celebrations of discharges, 200, 300, 400, 500. But you know, it was more how we can celebrate our successes than focus on the trauma that the virus brought to the organization and to the community.
And that Here Comes the Sun is actually, you have it on face masks and everything,
Yeah.
you know, which is great. And I've seen some video of it, of, you know, literally somebody's coming off of the ventilator, and that was played throughout the hospital. It was just a beautiful, beautiful way to kind of celebrate and change the focus.
Yeah.
You know?
My wife, Trish, found an artist in Brooklyn, and his name is Jason Naylor. And he's a muralist, I guess they call it, a graffiti muralist. And his messages are of hope and celebration and in beautiful, bold colors. And she asked if he would do the logo for us for Here Comes the Sun, so we could give everybody in the organization a T-shirt and masks. And he made this beautiful Here Comes the Sun logo for us, and you can see it around campus, but it was amazing that he donated his time and his effort to support the hospital. He actually came up to meet the staff. I think it was our 500th discharge. He was up to meet the staff and be part of that celebration. But, you know, just, again, community showing support for a local hospital.
Well, I can tell you this. I played in your golf outing a few weeks back, and one of the giveaways was a mask. But I don't have it because my wife immediately stole it from me.
I got a guy. I can
You
get
got a
you
guy.
one.
You got
Yeah.
me one. But Dr. Geller, I do want to thank you, aside from your personal friendship with both you and your wife, with me and my wife, but your leadership, and frankly, throughout this crisis, you were always willing to jump on the call with Dr. Leahy, the CEO at Bon Secours Good Samaritan, with me, with the other town supervisors. You both also joined a couple of my teletown hall calls, which was great, where people would had the ability to ask questions during the course of when we were really in some of the more intense days of the crisis. And it was a calm, reassuring message. We were able to give reminders to people, and we were able to also provide information. And when you're facing the unknown, when you're facing a crisis, not having information makes it worse. And you went over and above, beyond your leadership role as the CEO of the hospital. You didn't have to come on the call with the supervisors. You did freely. You did it like on a weekly basis for a good part of the crisis with Dr. Leahy. That meant a lot to me and the other 4 town supervisors, and helped us because we got real-time information. In addition to that, you provided a lot of information. I know you're a Clarkstown resident, as is Dr. Leahy, but you provided a lot of information to our residents directly. And that could have been a little nerve-wracking for you too, because you don't know who's calling in on those teletown hall calls. But people are still reaching out, thanking me for having you on. So I want to thank you for that as well.
And I'd also like to say, first and foremost, thank you very much for your friendship. It's been meaningful to me and to my wife Trish, and to Kathy as well. I also want to thank you for your leadership. I think you not only helped us get PPE, but I think you were there also as a common reassuring voice with consistent messaging to the community. And always, you know, whenever you would call me, it was always, what do you think about this? And it was always in the context of what should we be doing that's safe for the community? And yeah, I respect that tremendously, and you were on the cutting edge of that thinking. I appreciate your leaning on me to the extent that you did and that you trusted our input. But it was you that brought the message to the community and delivered the leadership to the community. So I want to thank you for that as well.
Thanks. And I will tell you, we made decisions based on what you and Dr. Leahy had kind of recommended. I mean, we kept things closed. You know, we made collective decisions as town supervisors. We pivoted on what we were doing. what I did with our swimming pools this year. I mean, we were very cognizant of that, and a lot of thought went into what we were doing in terms of our social distancing, what our practices were, what we needed to do at that period in time. And both you and Dr. Leahy and the information you provided to me helped us guide public policy, and that's really the way it should be. You rely on the experts, and you guys are experts. I'm still trying to make you the Dr. Oz of Rockland County, but we'll get to that. But we're way over time, but I do want to thank you, Dr. Geller, again, for your leadership. If folks want to support NIACC Hospital, how can they do that?
Yeah, so you can go to our webpage, MontefioreNIACChospital.org, and there's a foundation button on top, or a contribution button on top. You can go right to that webpage. You can donate to specific programs or in memoriam of folks, or just to the general funds. But as a community hospital, we rely heavily on the support of our community and appreciate everything that comes our way from the community. So thank you in advance to those of you who are thinking about doing so.
Great. And thanks again, Dr. Geller.
Thank you, Joe. Thank you.
Stay tuned. We'll be right back. Well, that's all the time we have for this special edition of Hometown Happenings. And again, I want to thank Dr. Mark Geller for his leadership and for taking the time to speak about the COVID epidemic and what we were facing. Until next time, I'm Supervisor George Hoehm. Thank you for joining us.